Hi, I'm Dr Miriam Stoppard and I'm here to give you some advice about nappy rash. 50% of babies get nappy rash in their first year. It's a form of contact dermatitis and it's a consequence of the damage to the skin from prolonged contact with faeces and urine. A baby's skin is really a work in progress and doesn't have the efficient barrier and healing properties of adult skin. That's why it's so important to remove a soiled nappy quickly, because it's faeces, and not urine as is commonly believed, that does the most harm. The symptoms of nappy rash are easy to spot, and you should be checking for signs every time you change your baby's nappy. The early stages of nappy rash cause the skin in the bottom area to become red and sore-looking. Your baby may be distressed, but also may not, perhaps a bit tetchy and unhappy, and possibly crying a bit more than normal. But if left untreated, nappy rash can go on to breaks in the skin and even little ulcers. This is uncomfortable and may upset your baby. For quick and effective treatment, I would strongly suggest that you don't use zinc or titanium oxide containing preparations to prevent or treat nappy rash, because they don't provide a very good barrier and are generally unsuitable for daily use for prevention. They're also difficult to remove because they stick to the skin, and this can result in frictional damage to the skin if you try to remove them too vigorously. Nappy preparation should be free of perfumes, free of fragrances, colors, preservatives, antiseptics, antibiotics, and antifungals, because all of those things can cause an allergic reaction in your baby's skin. In general everyday use, I would suggest bepanthen as the nappy preparation of choice. There's more than one kind of nappy rash, and they need to be treated differently. Although rare, babies can get nappy rash from thrush and bacterial infection, and this kind is mostly in the skin creases. The commonest kind of nappy rash is on the buttocks. But if you're worried about thrush or an infection, visit your GP, who may recommend you use an antifungal or antiseptic cream. There's no particular frequency you should change nappies. Your baby decides when you should change the nappy according to how often she wheezes and how often she has a soiled nappy. The most important thing that any parent could do to prevent and treat nappy rash is to remove a soiled nappy as soon as you get the slightest whiff, because it's the enzymes in stools that cause the problems. And finally, there have always been old wives' tales about the best way to care for your baby, and I've heard them all. For example, I can't see why there would be anything wrong in putting egg white on a baby's bottom, but why would you do that when there's such an excellent preparation that's simple and pure and is scientifically proven to moisturize, protect, prevent and cure nappy rash?